Good evening, everybody, and welcome to Hand Hygiene Updates in the era of a global pandemic. My name is Dr. Marie Fluent. I am greeting you from Ann Arbor, Michigan in the United States. I'm under the impression that we have attendees mostly from the United States of America, and then we have attendees from all over the world as well. So wherever you are, whatever time it might be, I welcome you and thank you for spending the next hour with me to discuss hand hygiene in the dental setting, specifically in the era of the global pandemic. My website is mariefluent.com. I invite you to visit me anytime after the webinar and pay a visit and say hello. Today, this webinar has been brought to us by Gojo, and they are the maker and the manufacturer of Purell hand hygiene products that are used worldwide in general settings, in medical settings, and of course, the dental setting as well. Thank you to Gojo for sponsoring this event. Our course description is this: a key principle of infection control is to take action to stay healthy. And one of the simplest action items, such as hand hygiene, is the most basic yet often misunderstood method to prevent the spread of microbes in the dental setting. So in our webinar, we will discuss how dental personnel are at risk for disease transmission, as that we can acquire pathogens on our hands from patients and surfaces and from other people in the dental facility. Hand hygiene in accordance with the CDC guidelines and OSHA standards will be addressed, as well as appropriate methods and motivation techniques to enhance compliance and ensure a safe visit for all people. Notice that I focus my attention on CDC guidelines and OSHA standards. Many of my attendees this evening are from the Middle East, and I do know that you do comply with CDC guidance as well. CDC is one of our nation's premier public health agencies, and the World Health Organization is also recognized worldwide as well. So whichever country you are visiting us from, these guidelines, the basic principles stay the same, although if you are practicing in a different country, they may be tweaked a little bit according to your guidelines. But the principles, of course, remain the same wherever you might be. Our objectives this evening, I have 5 of them. First, we're going to talk about the relationship between hand hygiene and the spread of infection. Second, we're going to talk about hand hygiene policies and protocol to mitigate germs that can be transmitted during the delivery of dental care. Third, we're going to talk about product considerations that may enhance hand hygiene compliance. Believe it or not, some products enhance compliance and others not so much. Fourth, we're going to identify appropriate methods of motivation and monitoring to enhance compliance. And these are a little bit different in the dental setting. In inpatient settings, there are many more electronic methods of tracking and monitoring hand hygiene compliance. But in the dental setting, we don't have those available to us. So we'll talk about what we do have available to us. And finally, there are resources for hand hygiene in the dental setting. And I'll give you some resources of where to go for more information, training, resources, etc. So according to CDC, hand hygiene is the most important measure to prevent the spread of infections amongst patients and dental healthcare professionals, DHCP. And this comes right out of the CDC guidelines. And so it's the most basic thing that we can do, and yet the most important measure that we can take in the dental setting to prevent disease transmission. But kind of very, very simple, yet very complex and often misunderstood. A quick couple of definitions for us. Hand hygiene is a definition that's an overall definition that includes both hand washing, either with plain soap or antimicrobial soap, or the use of alcohol-based hand rubs that don't require the use of water. So hand hygiene in of itself can refer to any of the above. Hand washing, however, is specifically washing hands with soap and water, plain soap and water under a faucet, running water, that is. Antiseptic hand wash is washing the hands with water and soap or other detergents containing an antiseptic agent. And an alcohol-based hand rub is rubbing hands together with an alcohol-containing preparation. Notice the amounts and the description of the alcohol in parentheses, 60 to 95% ethanol or isopropanol. Note that this will be appearing on a quiz somewhere in the near future. 60 to 95% ethanol or isopropanol is what the CDC recommends for using an alcohol-based hand rub effectively. Surgical hand hygiene or antisepsis refers to washing your hands or using an alcohol-based hand rub, often with persistent antimicrobial activity, before operations by surgical personnel. And this would be a biopsy, implant placement, a surgical extraction of a tooth. It can be periosurgery, endosurgery, etc. All of those are surgical procedures that all personnel involved in that procedure should be performing a surgical hand antisepsis or surgical hand hygiene. And this would be the operator and the assistant for this procedure. I also want to bring about, mention what persistent antimicrobial activity means, and that is an active ingredient in the product that continues to work after the product you're done using the product. It continues to fight the microbes on your hands even after you're done performing hand hygiene with the alcohol-based hand rub. Another definition for us is irritant contact dermatitis. This is the development of a dry, itchy, irritated area on the skin, and it's due mostly to frequent hand washing, gloving, and exposure to chemicals. Other contributing factors include the use of hot water for hand washing, low humidity, lack of hand care, lotions, and cold temperatures. Also, notice to prevent irritant contact dermatitis, it's important to have your hands completely dry before you glove up. If you have remaining active ingredient or wet hands as you glove up and perform that repeatedly through the workday, your hands will get irritated and dry and itchy. And I have a photograph coming up in some slides ahead of us about showing hands that have actual irritant contact dermatitis. And that can be pretty darn painful. For those of us who live in cold climates in the wintertime, we're more susceptible to irritant contact dermatitis. I live in Michigan, and our winters can be pretty darn harsh, and the humidity and the air around us can be very, very low. And those can be contributing factors as well. To combat irritant contact dermatitis, another thing that you can do is avoid hot water, avoid cold water, avoid temperature extremes in general. Use cool or tepid water, and that will decrease your likelihood for irritant contact dermatitis. Now, this slide shows that there are two types of resident flora on your skin, resident flora and transient flora. Flora is a coating of pathogens or microbes that are on the surface of your skin. Now, in resident flora, this is affected by the deeper layers of your skin, whereas the transient flora is on the superficial or outermost layer of your skin. The transient flora, because it's on the outermost layer of your skin, it's easier to remove, and it's acquired by direct contact. And that would mean touching a doorknob or touching a contaminated surface, a frequently touched surface in your dental setting, whatever it might, like a faucet for a drink, a faucet for hand hygiene. And these are more likely to be pathogenic, have germs in them that cause disease. And our goal in hand hygiene is to eliminate the transient flora, but reduce the resident flora or the deeper layers. These deeper layers are less likely to be pathogenic or cause diseases. And of course, they would be more difficult to remove. So keep in mind, we're not trying to remove the resident flora. We're trying to reduce it, but we are trying to eliminate the transient layer, the outermost flora of your skin during hand hygiene. Now, hand hygiene standards and guidance are brought to us by many agencies, and many agencies have their hand in hand hygiene, literally and figuratively. And what I want to share are briefly talk about a number of these agencies. Of course, you have state dental agencies and state dental boards, and you need to comply with their standards. Then the American Dental Association and the American Dental Hygiene Association also pretty much comply with CDC guidance. OSHA has standards that we must follow. And if you are in a state that has a state-specific OSHA program, you must abide by those standards as well. But all of these link back to the CDC that provides guidance to us in general. And then the products that we use are all monitored by the Food and Drug Administration in the United States. In other countries, you have a different overarching agencies that protects the public with regard to drugs, vaccines, and any type of biological product. But here in the United States, the Food and Drug Administration ensures the safety, efficacy, and security of drugs, vaccines, and other biological products. Now, CDC has taken that into consideration, and all of the products that we use for hand hygiene in the dental setting would be under FDA guidance. Now, the manufacturers of these products also provide instructions for use, and we must follow those instructions to a T. For instance, some products say only use a small amount to cover your hands so your hands stay wet for approximately 20 seconds. On the other hand, if you're performing a surgical procedure and you're performing surgical hand antisepsis, the quantity used might be different so that your hands stay wet for a longer period of time. So it's very important to follow the manufacturer's instructions for use on whatever product you're using. It might sound like common sense, but read those instructions and make sure you're using the product appropriately for the correct duration and the correct quantity. So that just gives you an overall arching idea of the agencies. I do want to point out OSAP on the upper left portion of this slide. That stands for the Organization for Safety, Asepsis, and Prevention. And that is our one and only infection prevention agency in the world dedicated exclusively to dentistry. If you're not a member, I encourage you to look at osap.org and pursue membership. Whether you reside in the United States or abroad. It is a great resource for anything infection prevention related, including hand hygiene. Now, in dentistry, in the healthcare profession, the CDC provides guidelines for hand hygiene. And the principal documents shown on the left-hand side are described on the right. First is the 2002 CDC guidelines for hand hygiene in healthcare settings. And this goes for any healthcare setting, dentistry, medicine, long-term care, any type of outpatient surgical facility, whatever it might be, whatever your healthcare setting might be, these guidelines apply to you. Now, if for dentistry specific, we have the 2003 CDC guidelines for infection control in dental healthcare settings, and I have the link there for you. And because this guidance document is a little bit lengthy, very scientific, and difficult to read, CDC came out with a new document in 2016 called the Summary of Infection Prevention Practices in Dental Settings, Basic Expectations for Safe Care. And this is depicted in the turquoise document and to the right of the other two in the middle of the slide. Now, this document is written in plain language. It's easy to understand, and it gives the nutshell version, the Cliff's Notes version of what we need to know with regard to hand hygiene and dentistry. And I'll get into those bullet points in the upcoming slides. Now, finally on this list, I say CDC interim infection prevention and control guidance for dental settings during the coronavirus disease 2019 or the COVID-19 pandemic. And I provide a link for you at the bottom of this slide. Now, I want to share with you that that's changed, and I'll get into nitty-gritty details in upcoming slides as well. But these are the four main areas where you would go in the United States to obtain hand hygiene information in any healthcare setting, including the dental care healthcare setting. Now, in the era of COVID, CDC has, as you know, has continually changed and updated its guidance as the scientific information surrounding the coronavirus has evolved and our understanding of disease transmission and mitigation efforts has evolved as well. So as of September 10th, 2021, in other words, just a couple of weeks ago, the COVID-19 information is now included in the infection prevention and control for all healthcare settings on the CDC website. And let's keep in mind that the guidance documents or the guidance document, any type of guidance during COVID-19 is considered interim guidance and is subject to periodic updates, modifications, and edits. So in other words, you need to keep checking back to this website for any updates. So if you refer on the previous slide to this bottom bullet point on the CDC interim infection prevention and control for dental settings, it's going to say this page is no longer being updated, and it's going to refer you to the healthcare settings page. And there's a small section in there that refers specifically to dentistry. Do I think this is a good idea or a bad idea? The answer is both. And I'm interjecting personal opinion here. On one hand, yes, we are absolutely a healthcare setting, and absolutely we should be lumped in with other healthcare settings. On the other hand, dentistry has some factors that are unique to the dental profession. And I'm hoping that this does not cause confusion to my dental healthcare colleagues by weeding through the pertinent information that's specific to the dental setting. So we'll see as time evolves, but that's what the CDC has decided at this point moving forth. So we also need to be aware of the degree of community transmission of COVID-19 in our specific area. So I reside in Ann Arbor, Michigan. So I pulled up on the CDC website, our specific county in Michigan. And what I noticed is that the community transmission in our area is indeed high. We have 500, this was current as of last week. The last time I updated my slides was on September 28th. So the number of cases in our area was 555 in our county, and our percent positivity was 2.94%. And the CDC takes both of those numbers into consideration as they develop whether or not they believe that the community transmission in our area is high or low risk. So keep an eye on your own specific area. If you live in the United States, I recommend that you use the CDC website. And if you reside out of the United States, there are tracking methods for your government agency as well. And if you have a hard time finding them, email me and I can help you track that down, that information down for you. But it's important to know the degree of community transmission of COVID in your specific area as you begin your practice of dentistry. Now, hand hygiene is important because it is, like I said, it is the number one most critical measure for reducing the risk of transmitting microorganisms to patients and healthcare workers. And we are at greater risk than our patients. We're the ones who are working on patient after patient exposed to contaminants throughout the workday. So we need to protect ourselves. It's estimated that every year, 2 million patients get a hospital-related infection, and hand hygiene reduces the spread of antimicrobial resistance and also prevents healthcare-associated infections. So this is called the chain of transmission, and I've seen chains of transmission depicted in multiple ways, but I chose and modified this chain of transmission because it pertains exclusively to hands, and it's a more simplified version than some of the others out there that I have seen. So in this chain of infection, there are 4 things that have to happen. Number 1, contact with a patient or contact with a contaminated object or a surface. So you have the pathogen on your hands. The second link is the pathogen itself, and the third link is the hands of dental personnel. So your hands are contaminated. The fourth link is that we have inadequate hand hygiene, or perhaps no hand hygiene at all. Perhaps we have a lax employee who says, I'm wearing gloves. It just doesn't make a difference. We know better. It does make a difference. And then we have contact with the subsequent patient, and voila, they may acquire an infection from our contaminated hands. Our goal in infection prevention is to break this chain of infection as much as and as often as possible. So if we have contact with our patient, we should be wearing gloves. If we have contact with our pathogen, of course, wash our hands immediately thereafter. And of course, we would be wearing gloves. And so we do not let this pathogen be exposed to our bare contaminated hands. Then, of course, we do perform hand hygiene, adequate hand hygiene. And in the upcoming slides, I'll discuss exactly what that means. And if we have contaminated hands, obviously, we don't touch our next patient until we clean them and re-glove. So those are the ways that we can break the chain of transmission on our hands. And that is our goal in the dental setting. So to break the chain of infection, we implement a set of protocol called standard precautions. Our Canadian colleagues who might be listening, you call this routine practices. They refer to the same set of infection control practices that healthcare workers use to reduce transmission of healthcare associated infections. This protects both the healthcare worker and patients from contact with infection agents. And in standard precautions or routine practices for my Canadian colleagues, every person and every patient is considered potentially infectious and susceptible to infections. And we have to keep that in mind. Standard precautions apply to every patient, every procedure, every appointment, every time. Now, in the era of COVID, we are implementing another set of precautions called transmission-based precautions. And these are used in addition to the standard precautions to mitigate transmission of COVID-19. And I won't get into the nitty-gritty details on that, but I just wanted to include that so you knew that I knew there are a little bit more measures and mitigation strategies with regard to COVID-19. Now we're going back to that key document I was discussing, the CDC document called Summary of Infection Prevention Practices in Dental Healthcare Settings, Basic Expectations for Safe Care. In that document, I mentioned that they have bullet points, and this is what the bullet points look like. So the key recommendations for hand hygiene in dental settings include performing hand hygiene when hands are visibly soiled and you've got visible debris on your hands. After you've barehanded touched instruments, equipment, materials, and any other object likely to be contaminated by blood, saliva, or any other respiratory secretions. We're going to perform hand hygiene before and after treating each patient, before we put on our gloves, and after glove removal. We'll use soap and water when your hands are visibly soiled, including blood or bodily fluids or other contaminants, or otherwise an alcohol-based hand rub can be used. Now, the CDC guidelines go on to say that they recommend a preparation that is 60 to 90% ethanol or isopropanol. And I'll get into that in upcoming slides, but because you're going to see that on an upcoming quiz, I'm going to repeat that a number of times. If you are performing surgical procedures, perform surgical hand scrub before donning your sterile surgical gloves. And for all hand hygiene products, it is very important to follow the manufacturer's instructions before you use them. And for complete guidance, see the CDC guideline for hand hygiene in healthcare settings. So that is the nutshell version. A couple things that I'm going to stress over and over again include following the manufacturer's instructions. And if your hands are visibly soiled, you must wash. Alcohol-based hand sanitizers will not be effective and will not remove the physical debris on your hands. Now, before we begin hand hygiene, there are a couple of things that are very important. It's important that you have clean and short nails, no artificial nails, minimal jewelry for general dental procedures. And if you're performing a surgical procedure, it's recommended that you have no jewelry at all. It's also recommended that you have no infections on your hands whatsoever. I do want to brag a little bit, if I may, that the picture on the to the left of the two images are my hands. And even though I'm not practicing dentistry anymore, I'm semi-retired, I still like to keep my nails short, rounded, and no nail polish. I think that's just because that's the way I always had my hands throughout my adult life while practicing dentistry. And that's what I'm more comfortable wearing to this day. Now, the hands on the right-hand side belong to a woman. I was getting my fingernails, a manicure, and there was a woman next to me who just had this manicure. And I said, "May I take your picture?" And she said, "Absolutely." And she was very proud of her artificial nails, her nail extensions, and her acrylics, and her polished nails. And they're very funky and very decorative, but personally, I would not want these hands performing dental care in me. It's fine for day-to-day life, whatever she's doing for home and personal use, but in the dental setting or healthcare setting, it is not appropriate. So please don't have long nails. If you have to have polish during a general dental procedure, make sure your polish is fresh, not chipped. No polish at all for surgical procedures, no nail extensions, because that is where bacteria is harbored around the edges, perimeter, and underneath these long nails. So not appropriate for dentistry. Now, here are the indications for hand hygiene in the dental setting. At the beginning of the workday, we need to wash our hands thoroughly for 1 minute. Yes, you've already taken a shower and cleaned up and freshened up for the day, but between that morning shower and getting to work, your hands have been through a number of things, including driving your car, touching frequently touched surfaces, maybe hugging children goodbye, whatever you're doing to get to the office at the beginning of the workday. So a thorough 1 minute wash is what you should be doing before you begin your workday. Then before gloving, after glove removal, throughout the workday, you can feel free to use a hand wash or an alcohol-based hand rub. Now, when your hands are visibly soiled or contaminated, you must wash only, no alcohol-based hand rub. Before eating, and after personal functions, using the restroom or reapplying makeup or whatever you're doing to freshen up during the workday, go ahead and wash again. And of course, we already mentioned before surgical procedures, a thorough wash with antimicrobial soap and water, or plain soap and water followed by alcohol-based hand rub. And I'll get into those details in just a minute. But those are the basic indications in the protocol for hand hygiene throughout the workday. Now, direct from the CDC webpage with regard to COVID-19, CDC says that hand hygiene is an important part of the response to the COVID-19 pandemic. Hand hygiene, the use of alcohol-based hand rub or hand washing, is a simple yet effective way to prevent the spread of pathogens and infections in healthcare settings. The CDC goes on to say that the exact contribution of hand hygiene to the reduction of direct and indirect spread of the coronavirus between people is currently unknown. However, hand washing mechanically removes the pathogens, and laboratory data demonstrate that alcohol-based hand rub formulations and concentrations recommended by CDC inactivate the SARS-CoV-2 virus. That is the virus that causes COVID-19. So alcohol-based hand rubs effectively reduce the number of pathogens that may be present on healthcare worker hands. So in the era of COVID-19, CDC provides the following recommendations. So indications include all of the indications that I just shared with you on the previous slides, plus anytime we adjust our masks or respirators, or anytime that they are removed. CDC recommends placing signage to encourage hand hygiene at the point of entry of your facility and in the lobby area. They also recommend that we provide hand hygiene products for patients and visitors who enter our facility. And we should have been doing that before COVID hit, but now it's even that much more important. And we're seeing more and more facilities, medical, dental, and non-medical, that provide hand hygiene facilities for anybody entering the facility. We should be encouraging all patients and visitors to perform hand hygiene with alcohol-based hand rub when they enter the clinic, and perform hand hygiene after we don and after doffing our gloves. So we should be going through lots more hand hygiene products, in other words. Now, here is an example of a CDC hand washing poster, and the CDC has many posters, fact sheets, and brochures available for patients, staff, children's, teens, family, whatever type of practice that you offer. And of course, these are available in various languages wherever you might be practicing dentistry, and in any level that you might be geared for. In other words, if you're in a pediatric patient, you may choose a poster that would be appeal to children, and look for something that is specific to your type of facility. CDC offers these posters free of charge, and you can download them and print them and laminate them if you wish, and post them in the lobby of your facility. Now, let's get into hand hygiene techniques, and we'll start off first for non-surgical procedures. These are general dental procedures that most of us are performing throughout the workday. So first, we obviously need to wet our hands and wrists. We apply soap and use the quantity recommended by the manufacturer. And if you are using a pump that is a disposable pump, generally one push of the pump is the amount that the manufacturer wants you to use. In this setting on the right-hand side, the dispenser is incorporated into the cabinetry. And by the way, I'm going to go off on a tangent right now. To refill that dispenser, you have to get underneath the cabinet. And if you do that, don't just top off and add more soap to the existing container. You should use the container all the way to completion, remove it, rinse it out, dry it out, make sure it's thoroughly clean, and then refill it with the appropriate product. I much prefer a disposable product because it prevents the recontamination or contamination of the dispenser itself or the bottle or any components of it. So I just went off on a tangent, but I thought it was very important to interject at that point. So thank you. Then we rub our hands together and lather for at least 15 seconds, ideally 20 seconds. And I'm sure we've all heard that if we sing happy birthday to you twice, that is approximately 20 seconds. Make sure that you clean between your fingers, around your fingernails, under the fingernails, and backs of the hands, all the way up to your wrists. In some countries, when you perform hand hygiene, you're performing hand hygiene up to your elbows. So make sure that you follow the instructions with whatever country you practice in. In the United States, for general dental procedures, we are lathering and washing up to our wrist. Then we rinse well under running water and dry hands completely with a disposable paper towel. Use your paper towel to turn off the faucet, and this should avoid recontamination of any frequently touched surfaces in your facility. And that would be the end of a hand washing procedure. Now we're going to switch gears a little bit and talk about hand hygiene for using an alcohol-based hand rub. So first of all, it's important to dispense the correct amount specified by the manufacturer. And I already hammered that into your head, so thank you for listening to me again. Apply to one palm of one hand and rub your hands together, covering all surfaces until dry. Make sure you include the clasped fingers in your palm, working around underneath your nails and into your cuticles. Rub your hands together, palm to palm, including your wrists, and between your fingers, and switch hands and repeat. And palm to palm, fingers interlaced. Then make sure you get the tops of your fingers to your palms. And then don't forget your thumbs. Rub your thumb clasped in a palm, switched hand, and repeat. And keep performing that over and over again. And make sure you use enough hand rub to require at least 15 seconds for your hands to dry, ideally 20 seconds. Now, if your hands are dry in 7 to 8 seconds, then you haven't used enough product. Go back and review your manufacturer's instructions and use a little bit more product. Make sure your hands are wet for the duration of the 15 to 20 seconds. And I'm repeating myself again, but don't use alcohol-based hand rubs if your hands are visibly soiled. If your hands are visibly soiled, you must physically wash them to remove debris and send it down the drain. Now, if you are performing hand hygiene for surgical procedures, you have two choices. Your two options are, number one, you scrub your hands with an antimicrobial soap with persistent activity. And we already talked about what persistent activity means. And you follow the instructions given to you by the manufacturer. And that will be generally in the 2 to 6 minute category. Or the other option is to wash with plain soap and water, and you follow that with an application of alcohol-based hand rub with persistent activity. And once again, the alcohol-based hand rub would be 60-90 to 90% ethanol or isopropanol. Now, I said I was going to come back to this image regarding irritant contact dermatitis, and here we are. And this is an actual image of a dental hygienist of mine. And she said to me, "Oh, Dr. Fluent, my hands are so irritable today. It just hurts to physically apply the alcohol-based hand rub. And I just kind of don't even want to wash my hands right now. Can I just use gloves?" Well, there's a couple things that I want to say about that statement. And that is, number one, the alcohol-based hand rub is not the cause of the irritant contact dermatitis, but it can sting irritated skin and abraded skin tissue. So the cause, of course, would be frequent hand hygiene, not drying your hands before gloving up, or temperature extremes when washing your hands, meaning very hot water or very, very cold water. And your symptoms include dry, irritated, itching, cracking, and sometimes even bleeding of skin. It can be caused by certain antiseptic agents, and that's why you want to choose a product that has been developed for healthcare settings and is intended to be used repeatedly throughout the workday. I encourage you not to bring in products from home that are intended for home use. These products have been manufactured knowing that people at home will wash their hands maybe 2 or 3, 5 times a day, whereas in the dental setting or in an orthodontic setting, you may be washing your hands upwards to 100 times a day. Manufacturers of health-grade products know this, and these products are actually more gentle and easy on your hands while being more thorough at removing the pathogens that accumulate in the transient flora. So allergic contact dermatitis is a little bit different. This is caused most likely by fragrances and preservatives in the product that you're using. And that is another reason why we should be using health grade products in the dental setting, not products intended for home use. And note that allergic reactions are rarely caused by alcohol-based products. There also can be respiratory allergies due to fragrances that are included in some of the hand hygiene products. And if you have a patient or a healthcare provider who has asthma, that can trigger asthmatic type symptoms. So make sure you use a product that has no fragrances or very light or pleasant fragrances that don't cause those types of reactions. So strategies to reduce irritation include using an alcohol-based hand rub with emollients when indicated, making sure that your hands are dry prior to putting your gloves on, using alcohol-based hand rubs and allowing them to evaporate completely before donning your gloves, and making sure that you use hand lotions and other skin moisturizers to protect the dermis of your skin, or the epidermis on your skin. So note that because healthcare workers perform hand hygiene very frequently, alcohol-based hand rubs with emollients are better tolerated by them than hand washing. So a little bit about hand lotions. Hand lotions are a good thing to use throughout the workday. They increase skin hydration. They replace the depleted skin lipids on our hands, keeping them more moisturized. They help maintain the barrier of our skin and help treat or prevent contact dermatitis. And they potentially enhance hand hygiene compliance. So it's a good idea to take care of your hands. This is our first line defense for ourselves and preventing disease transmission and amongst ourselves and our patients. Now, when it comes to selection of hand hygiene, once again, it's recommended to only use hospital or healthcare approved hand lotions. For my Canadian colleagues, that would be Health Canada approved lotions. Consider the interaction between lotions, gloves, and dental materials and antimicrobial products, and know that petroleum-based products or mineral oil-based products can weaken the glove integrity and increase permeability. In other words, if you're using latex gloves or a synthetic type of glove, if we're using a petroleum-based product, you can have little micro perforations within our gloves and increase permeability, making our gloves less effective. So don't use at-home based products in the dental setting. Also, keep in mind that hand lotions often contain humectants and emollients to keep our hands softer and our skin more healthy. And I repeated this over and over again, not a good idea to bring products from home. So hand hygiene products consideration, the most important thing that we need to consider is that the more widespread use of hand hygiene products that improve hand hygiene adherence to recommended hand hygiene practices will promote patient safety and prevent infections. So in other words, let's boil that down into the statement that the more the dental team likes a product, the more likely they are to use that product. So this is a good reason to have your entire dental team involved in product selection to make sure everybody's on board and everybody approves and likes the product. And that will greatly enhance your hand hygiene compliance in your setting. Look for medical grade products or products that are intended to be used in hospital settings or medical settings. Make sure that you have compatibility with your gloves and other hand hygiene products. And if you're in doubt, look up the manufacturer of your hand hygiene product and give them a call. They generally have specialists on board who can handle complicated questions and scientific questions like compatibility issues with whatever else you might be using. And they want to hear from you, and they want to be an extended member, a family member of your dental team. Look for products that contain skin-containing agents. Look for products that are indeed effective. We want a minimal and pleasing fragrance, something that's non-allergenic, something that's non-greasy, especially when it comes to lotions, and something that is acceptable to all of your dental team members. Now, in the era of COVID, this concerned me. We saw more and more manufacturers step into the plate and making products that are intended for hand hygiene. But some of them looked like drinks, candy, water, alcoholic beverages, cocktails, water bottles, etc. And unfortunately, there were a number of instances of poisoning because people drank these products, especially especially in the era of COVID. So I encourage you to stay away from products that don't look like hand hygiene products, and make sure that look at the active ingredient. My number one bullet point that says that methanol or 1-propranolol are not acceptable ingredients. And unfortunately, some of these off-label manufacturers were using those products as active ingredients. So go back and check your active ingredient and make sure it does not contain methanol or 1-propranolol. Instead, we are looking for ethanol or isopropranolol. Products that do not contain the sufficient amount of alcohol, we need 60 to 95% of ethanol or isopropranolol. Some of these products can have false or misleading or unproven claims. Those that are marketed as FDA approved, beware, because none are FDA approved. So look for that as well. It is best to stick with your manufacturer catalog that you use in your dental setting, and stick to a product that is intended for healthcare settings. Now, this is something that I never would have included in my hand hygiene presentations before, but this is an image that was taken in a non-dental setting. I'm proud to say this was not in dentistry. I always included in my hand hygiene lectures before, never used bar soap. But my mentor came to me and said, Marie, nobody uses bar soap in a healthcare setting anymore. Everybody knows better. And so I took my grandson to the pediatrician, and lo and behold, this is what I saw. So let's zoom in on that. And this is what I want you to see. I want you to see the crud, the grime, the debris, and likely contamination of this dish. And healthcare professionals are touching this and retouching it throughout the workday. So I will include this into my presentation. Never use bar soap in a healthcare setting, including the dental setting. You're recontaminating your hands and potentially contaminating others and your patients. Bad idea. So let's talk about hand hygiene in dentistry. On average, and keep in mind, this statistic was taken in the pre-COVID era. I'm so interested to see how our compliance has improved in the era of COVID. But pre-COVID, just before COVID, CDC said that on average, healthcare providers clean their hands less than half the times they should. On any given day, about 1 in 31 patients has at least one healthcare associated infections. So statistically, if you're at the 50% mark, you could go into any healthcare setting, flip a coin, and heads, your healthcare professional may perform adequate hand hygiene, and tails, they may not. And that is that's just not acceptable. So we need to do something about compliance. Back in 1850, 100 and some years ago, Isaac Semmelweis, who is the father of hand hygiene in medicine, looked at hand hygiene, and this is before the germ theory was ever discovered. He learned that hand hygiene was effective at preventing infections in maternity wards for women who are giving birth to babies. And he looked at the compliance rate way back then. And reasons for non-compliance in the 1850s were that a physician was a gentleman. Of course, women were not in the profession. And it was insulting to insinuate that a physician's hands were unclean. Doctors were offended at the suggestion that they should wash their hand because a physician is a gentleman and a gentleman's hands are clean. And of course, there were a lack of supplies and a lack of equipment, and there was no scientific evidence that hand hygiene was effective. Now let's fast forward for reasons for non-compliance here in 2021. And I say blah, 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 because this goes over people's heads. They think, yeah, I already know all that. I wash my hands all the time, and yet you wash them and hand hygiene is inadequate. So some of the current reasons include lack of awareness of basic hand hygiene principles, understaffing and insufficient time. Let's face it, 20 seconds of hand hygiene is 20 seconds less of patient care. Washing agents can cause skin irritation and dryness if you're using frequent soap and water. Some offices have inconvenient location of the sinks or lack of sinks. There can be lack of soap and paper towels in the proper area. Wearing of gloves, I've seen that seen as a substitute for hand washing, but of course we know better. I've heard dental personnel say to me, well, my hands don't look dirty, and there's a perceived low risk of cross infection. And all of these are like, people just kind of ignore these reasons, and still we have a high rate of non-compliance. Now, has the hand hygiene awareness increased in the era of COVID-19? And I want to show you this picture, and this is not a medical or dental setting. This is a smoothie station, and this is the picture of my granddaughter, and we're getting a smoothie right after I picked her up from school. As soon as you walk into the smoothie station, this is what you bump into. You have no choice but to either wash your hands or walk around this behemoth of a sink with 4 stations for hand hygiene. Notice there's soap strategically placed at every corner. What you can't see is a very convenient foot pedal, so you don't have to touch anything, any controls on the faucet. There is a station for disposable hand towels adjacent to this, and a hands-free dispenser, trash dispenser right on our receptacle right to the left of it. And this is right smack in the center as soon as you walk in this facility. And anybody who walks into this facility knows that hand hygiene is important. And you see people at this station all of the time washing their hands. This is brand new in the era of COVID, and I thought this was really cool. I know that in the dental setting, most of us don't have the real estate in our lobbies to install such a hand hygiene station in our facilities. On the other hand, if you did have a way to promote hand hygiene to your patients and let them know and let anybody know entering your facility, hand hygiene is important here. Think of those creative ways and implement that as a dental team. Here are some other strategies to enhance compliance. Monitoring, that is physically watching people wash their hands. Administrative leadership, meaning those in charge, if they are performing hand hygiene on a regular basis. And adequately, that leadership rubs off on the rest of the team members. Emphasize the use of alcohol-based hand rubs, make products available and readily accessible, encourage a buddy system and peer coaching to each other. So one person is not in charge. Each person has a buddy, and you're cheering each other on. Perhaps you can have promotional items such as screensavers or posters or brochures for both patients and dental personnel. Of course, include clinical personnel in product selection, education, ongoing discussion, perhaps at your morning huddle. Encourage the use of facility provided hand lotions. Provide performance feedbacks, rewards, and recognition, employee involvement, checklists, and observations. And I wrote an article on hand hygiene compliance, and this is one article that I liked: Technology Tradition, Get a Grip, and Infection Control Today. And the best approach is a bundle of these strategies to enhance compliance. If you just chose one of these options, your chances of an ongoing program hand hygiene effectiveness would be slim to nil. But if you chose a bundle of these approaches and considered it changing them up on a regular basis, perhaps that you would have enhanced compliance over the long haul. Now, there is a new resource that I want to share with you. The CDC has come up with training modules for the dental setting. It's called Foundations, Building the Safest Dental Visit. And the information is taken from the CDC Summary of Infection Control in the Dental Healthcare Setting, that document that I shared with you at the beginning of our session today. And there is a learning module on how to, infection control in general, Foundations of Infection Control. And there's a section in here specifically on hand hygiene. And that's brand new, about a month old. So I thought I would share that with you. The references and resources I'd like to provide to you include the CDC documents, and I shared these with you already, the guidelines for infection control in the dental healthcare setting, the summary, the hand hygiene specific document that was published in 2002. And now we have the hand infection control guidance in healthcare settings. OSHA has guidance for dental workers and employers. The American Dental Association has guidance as well in the return to work interim guidance. The American Dental Hygienists Association has guidance. And of course, look at the Organization for Safety, Asepsis, and Prevention as well. If you live out of the United States of America, you might also consider the World Health Organization, and our Canadian colleagues may also follow the World Health Organization guidance for hand hygiene, the 5 moments for hand hygiene. So wherever you live and practice dentistry, make sure you follow the guidance for your particular country and province or area. On that happy note, I want to say thank you so much for spending this time with me. And I'm going to let Trung take over. You will be guided to a quiz at the end of this presentation. And I believe I answered all of the questions adequately. So please, it shouldn't be too difficult for you, in other words. And that happy note, I'm going to look and see if there are any questions. And I do not see any questions in the question box. So I'll give it just a minute or two. And if you have any questions, please type them in. And if you have questions after the fact, please feel free to contact me at mariefluent.com. And I see Christy was here. Thank you so much. And somebody raced home to hear my lecture. Thank you so much. On that happy note, I don't see any questions other than thank you and positive remarks. So thank you all for spending this time with me. On that happy note, thank you to Viva Learning and Trung for facilitating this and providing tech support for me. Without his expertise, this never would have happened. And I wish you all a good evening or a good day wherever you might be. Thank you so much.